The topic of today's discussion is calcium and vitamin D. What happens when calcium is actually decreased in the body, and what is the job of the vitamin D in this mechanism? Well, first of all, when there is decrease in of calcium in the blood, the very first signal is being received to the parathyroid gland, the gland in the neck region. Parathyroid gland. Now, this gland is actually responsible to release some hormones known as parathyroid hormones. Now, these hormones they are responsible to give signals to two very important portions in order to maintain the level of the calcium. So, the very first signal given is to the bones. It says to the bones, "Hey, bones, please provide me the calcium." So, in the meanwhile, bone starts releasing calcium as per the order of the parathyroid hormone. And in the meanwhile, it orders the kidneys to reserve or conserve the calcium in you. Do not let calcium out in the urine. So what happens? Calcium starts reserving. There is a conservation of the calcium in the kidney. In the meanwhile, the bone is releasing calcium in the blood. So blood level is actually start blood level actually starts rising up. And in the meanwhile, parathyroid hormone stimulates the kidney where vitamin D is actually activated. Vitamin D activation actually takes place. Now, this activated vitamin D in the kidney, okay, there is a very big discussion regarding this point of view. Not big, a very good discussion regarding this, that how vitamin D is activated and why vitamin D is activated in the kidney. What's happening here? By actually, we have explained that in our previous lecture. You can watch that. Well, vitamin D is actually activated in the kidney after a long run. Now, this vitamin D will actually then do a single and interesting job. That is, it will move to the intestine, and from the intestine, it will absorb the calcium. Alongside, there is some other absorption also, but our focus is on the calcium in this lecture. So, what is happening? Vitamin D is absorbing then the calcium from the intestine and providing the calcium to the blood. So, what is happening hereby? We are getting the calcium from the blood, from the intestine, from the food that we eat, and that is then forwarded to the blood. And in the meanwhile, we do get the calcium from the bone. So from the bone and from the blood, actually from the food in the blood. So both the sources, bones and food, are providing the calcium, and that calcium is then maintained in the blood. So from the food we get by mean of vitamin D. Vitamin D helps in the absorption of the calcium, and in the bone is actually from the bone is actually released by mean of parathyroid hormone. Parathyroid hormone told the bone to release the calcium. So we got the calcium in the blood from two sources by mean of parathyroid hormone in the very beginning from the bone. It ordered the bone to release the calcium. So level raised a little bit in the blood by mean of the released calcium from the bone. And the second was by mean of the vitamin D. So vitamin D was activated in the kidney, and that vitamin D then actually started absorbing the calcium from the intestine and provided the calcium in the blood. So then, when the blood calcium rises, actually, so when there is actually a limit available, that limit is when reached. So then, the parathyroid hormone is actually inhibited because of the high level or normal level of the calcium. And in the meanwhile, what is happening then? Then further signals are actually stopped. There is no more release of the parathyroid hormone. Why? Because sufficient calcium is available now. And in the meanwhile, kidneys are actually responsible to do their job. Before it was supposed to conserve. Now it will just release the excess calcium in the urine. And in the meanwhile, the calcium that is actually now available in excess, the same vitamin D is responsible to maintain this calcium level in the bones also. So it starts depositing calcium in the bones. Alongside, it is actually maintaining the level in the blood, the level of the calcium in the blood. Okay, so that is how interesting calcium is. Vitamin D is it's doing its job in maintenance of the level of the calcium, and we have a very wonderful source of vitamin D that is from the sun. And we can get from the supplements also. So from the sun we get naturally. So this is all what's happening naturally in our body to maintain the homeostasis of the body, the normal functions of the body. So when it actually fluctuates, then we are supposed to go through some treatment strategies. I hope you got this discussion. If still you have any kind of question or confusion, drop that in the comment box. And don't forget going to the description for a little bit more discussion about the topic. Thank you for watching.